Dr. Bojana Yankovic, and I'm here today with Dr. Katie Belesne, my dear friend and dermatologist, and we're going to talk about hair loss. So what are some of the common causes of hair loss? What are some of the things that we can do to diagnose the cause of hair loss? And what are the treatments? So I'm going to start by talking a little bit about telogen effluvium, one of the common causes of hair loss, and something that we certainly see often, both in internal medicine practice and in dermatology practice. One of the things that I will start off with when I see a patient with hair loss that can be characterized by hair shedding or hair thinning is I'll think about the medical reasons first. Of course, being an internist and kind of having to look at the broad picture, we think about could there be something going on with the thyroid? So we'll check a thyroid stimulating hormone test. We'll also think about could there be an iron deficiency? So we will check a complete blood count and iron levels to check if there's an iron deficiency anemia. We also think about other causes that could be stress, so whether it's physiological stress or whether it's actual emotional stress that could be causing it. It could also occur in the setting of postpartum. So sometimes women can lose hair during the postpartum period and then it'll come back. So Katie, can you tell us a little bit more about what are some of the other causes? Once we've ruled out some of the medical causes and we've referred the patient to you, what are some of the things that you typically look for and other common causes?
Yeah, telogen effluvium, like you said, can be caused by many things, and we hope that it is often short-lived. There's chronic telogen effluvium, though, as well, which is, ongoing stressors. Some people are on crash diets or different, are eating more unique things that may, not have the building blocks, the minerals, et cetera, that it's needed for their hair. Other things in terms of medications that could cause it. There's a number of different factors that could be influenced, many of which you discussed. So now that we've sort of talked about some of the causes, often we go into treatment next, and that's what patients want to know. They're like, I appreciate that I have it, but now what can you do for it, right? And so as you mentioned, if there's something we can optimize, if their thyroid is off, and we can optimize that. If they have a low iron or low ferritin, which is a measure that we often test for, then iron supplementation may be important. And there are other medical treatments that we can do for telogen effluvium, the most common probably being Rogaine or minoxidil is the other name for it. And that one does have some data around stimulating hair, or at least protecting the hair that you've got now so that you're not losing more hair.
And what is the general efficacy of that? I assume it depends on what the actual condition is.
Yes.
But when you talk to people, is there sort of a range that you give them in terms of how likely they are to improve?
And this really, like, the data in the literature has varied around the exact statistics. One thing that I'll often say to patients, and I'll kind of say, in about 1/3 to 2/3, we'll see some improvement. Maybe that will be some regrowth, or maybe it'll just be stabilizing their hair. And that's, a good enough number for them to consider going, because as you know, Rogaine is a treatment that you need to stay on. So it's not something that you can do for a couple months, get some hair growth and stop. It takes at least 6 months to see results, and you need to stay on it long term in order to maintain those benefits. And then, for some in the ballpark of maybe around 1/3, they might not see much at all. And so you do have to give it the commitment for 6 months and then find out how you respond to it.
And now what about when we're looking at, let's say we're treating iron deficiency anemia, or we're treating the hypothyroidism, and we optimize that condition? How long after that condition has been optimized should people expect to see normal hair growth?
Yeah, and I always tell people, like, if you think of how slow hair grows, it takes a while, right?
Yes.
And I see people and they're like, I'm seeing nothing, and it's been 3-6 months. But when I look at them closely, I'll see all the little flyaways and new hair growths starting, right? And it's not obvious. Their hair hasn't become thick yet. It takes a while to get to that time frame. So I do typically tell my patients, I have to wait at least 6 months to see any improvement. So go away, come back in 6 months, and let's see where you're at. In part, I say that to really encourage patients to stick with it, right? If you only do things for a couple weeks and say, I don't see much, you haven't actually got to that part in the hair cycle where you've grown enough hair.
And when it comes to natural treatments for hair loss, is there any role of biotin or vitamin B7? I have patients that take it, and some people really swear by it, and I'm just curious as to what the actual evidence is.
Yeah, there is some limited evidence around biotin, and so it is one of the vitamins or natural things that people can do, and so certainly iron supplementation being another one, biotin, even vitamin D has some evidence, and so those things, if we optimize, I think that that's a great strategy for people who are not interested in medical treatments. There are other things that you can do from a vitamin mineral perspective that can be helpful as well.
Well, I hope this has been helpful. This has certainly been very educational for me. So thank you so much for joining us, and thank you for watching.